Hey guys, welcome back to our channel, and today we're going to talk about breastfeeding, nursing, bottle feeding, and of course pumping. And we're going to share our best tips with you that will help you as you nurse your newborn and up till when your kids are a couple of years old, which is what we're doing, and we're not running out of any milk supply. You will hear giggling in the background. You will see kids in the video because hey, this is a video about breastfeeding, bottle feeding, nursing, pumping, and it involves who? The stars of the show, these kiddos. So please bear with me, but I want to provide you with the best tips that you can use for breastfeeding, for bottle feeding, for nursing. And as you can see, my son is trying to take a hold of my earrings, so I might just have to yank those off of this video. These are tips that worked for us. They work for people who are close to us, so we're hoping that they will work for you. They might not, and that's just something I just want to make clear from the beginning, that even though they work for us and for other people close to us, it doesn't mean that it will work for you, but we're hoping that if you follow through with some of these tips, that they will help you as well. And you know, breastfeeding and bottle feeding can be a struggle, but we want to make sure that you hear what worked for us, and we want to make sure that we provide you with the best tips that we can provide you, and we're here to learn from you too, right? So if you want to share things that worked for you, please do so in the comment section below. Guys, this video is for you, whether you're a single mom, whether you have a partner, whether you have a spouse. This video is really here to help you cope with breastfeeding, bottle feeding, and pumping. Mommy! And there goes my phone. But first and foremost, I just want to say, please, also look to your lactation consultant or your doctor to provide you with tips for how to breastfeed, for how to bottle feed, how to nurse, and how to pump. Okay? First and best advice that I can give you, because some of you will need that. Aside from that, please also take advantage of classes, free classes especially, that are offered in your hospital, in your community. Look online, you might find some very close to you. Do not take those for granted. They're very important and they can teach you a lot. And most importantly, please also listen to some advice from your family members, and do not be afraid to ask them as well, because the people closest to us may be the best teachers. So look to your friends, look to your parents, look to your co-workers, whoever you're close with and whoever you can speak with, because they can have some very valuable tips and lessons for you. Let's go to the hospital. All right, so you've given birth. Loving baby in your arms, in the little carrier, or in the NICU, which was what happened with me, with my daughter. She was in the NICU. But if your baby does not need to be in the NICU, make sure that you're rooming with your baby as much as possible. Yes, I know that you're exhausted and they can take the baby away to the hospital nursery, but I would really advise that you room with your baby, because guess what? The more you room with your baby, the more you feed your baby, the more you stimulate your body. The more your body is stimulated, the more your body learns to produce more milk, and you will be happy, and vice versa. If your body does not learn to produce more milk, it will decrease the milk supply. So you want to make sure that you room with your baby. Excuse me. Okay, so make sure, as I mentioned, just make sure you room with your baby. The first couple of days, you're going to produce what is called colostrum, and it's like a syrupy, creamy type of, milky substance. And it's going to be very little as it comes out. In fact, when I was feeding my daughter and I was pumping for her, it was coming. We were feeding her with syringes. Guys, let me show you what I mean by syringes. Do you see this, guys? Syringes. And some of them are so tiny. I mean, it's like a teaspoon or a spoonful, a tablespoon. I mean, it's so tiny. And, we used to just take these to the NICU and they would press, release them into her mouth. And this is all that she needed. There are times when she did use formula, but that's another topic, guys. And I'll make sure to try and stay very focused, because if I start talking about everything, we're going to be here the whole day. If your baby must be taken, for any tests, for weighing, for checkups, make sure that you're pumping when your baby is away, because that will help you as well. And you'll produce very little milk to begin with. That's actually all they need. And you might even just produce just a few drops, right? And literally I was producing, I'm saying we were, my husband was right there, but I was producing drops. I was in the hospital for a couple of days, so they did give me a hospital grade pump, which was right there with its stand, so convenient. They gave me bottles, they gave me syringes, and it's all that the baby will need actually for the first couple. Yeah, you will hear baby noises in the background, because guess what, guys, we're parents. Your parents. Don't worry about milk supply, right? And that is all that your baby will need, because their tummy is so tiny, and your milk will actually come in 3 to 5 days after you deliver. As I mentioned, colostrum is the first thing that will come out. Your chest, your breast will start to really harden and expand 3 days after you give birth. So don't worry, that milk supply will come in, unless you're someone who's experiencing some real issues medically and you're not able to produce milk. But that's okay. Breastfeeding is not for everybody, and as I mentioned, we're going to be talking about bottle feeding as well. Okay, make sure that you embrace feeding your baby often, because newborns will feed, fall asleep. You might want to tickle their feet a little bit to keep them awake, or touch the corner of their mouth, to encourage them to continue feeding. But yeah, just embrace it, and that will help you with your milk supply as well. Now, before we even move on to anything else, it's very important that the baby latches on correctly. And I might actually just bring my son to come so I can show you exactly how to hold your baby when you're breastfeeding your baby. You want to make sure that their nose is to your nipple, and that they will find your breast, your nipple eventually. So you put their nose and then their mouth. They'll smell, and then they'll find their way to your nipple with their mouth. And you will tell immediately if the baby is latched on correctly. If they latch onto the wrong part of your nipple, you will experience a lot of pain. So stop and try again. Just keep on trying, guys. This is all about being patient, because it's going to take a long time for some of you, and your breasts will be sore. They'll be tender, and you'll feel like giving up. But please don't give up, guys. It's so rewarding for you and your baby, even if it's pumping and not breastfeeding. In particular, but just don't give up. You're gonna be tired, guys. We're all tired. Trust me, we're all tired, but you know what? We have to be strong for our babies, and make sure that you involve your partner from day one. They're so important. Even before you give birth, take classes together, read together. When the doctor is talking, go to appointments together. It's very important to involve them. They need to bond with the baby too. If you're single, of course, you don't need that advice, but otherwise, just make sure you involve your partner from day one, because they will be an incredible support for you. I know my husband is an incredible support for me. So anyway, let's move on to the right latch, and also holding your baby. You can hold your baby. Do not hold the back of the head and press it against your chest. Make sure you hold the nape of their neck, and that their feet are also touching another part of your body, because that makes them feel snugly and secure. I know my babies are touch babies, and they're always trying to find me anytime they're feeding. So make sure that their feet are also touching some part of your body as they're feeding. You can also do belly to belly, as I said, nose to nipple, and your hand at the nape of their neck. And you can also hold your baby like a football, right? And that's something that I did with my daughter. I had her tucked in here and I held as a football, and you know, whether it's the right hand or the left hand, depending on what you're comfortable with. But eventually, guys, you want to make sure that your baby gets used to both of your nipples. Do not let your baby get used to only one side, and like I said, unless medically necessary. You can hold your baby in different ways, whichever way that you're most comfortable with, okay? And I'm going to go ahead and actually show you the few ways that you can hold your baby when you're breastfeeding. And my ultimate and favorite position is lying down in bed and breastfeeding my baby. That helps them sleep, especially if you're somebody who co-sleeps with your baby. I am a supporter of whatever you choose to do, whether you choose to co-sleep with your baby, and of course there are safe ways to do that, or whether you choose to put your baby back in their crib. So my ultimate and favorite position is lying down feeding my baby. It has always worked so well, especially when you're tired. Your baby will fall asleep like an angel when you lie down and sleep next, because you're gonna be next to them, they're gonna be lying down, they're gonna feel warm and secure. I really do encourage that. Okay, honey, do you think you can bring Franco so I can show them the different ways? Come on, handsome. Here's my little baby boy. As you can see him up there, and I have my little star over there too, Sarah. Anyway, if he's not too wriggly, I'm going to go ahead and show you. So in terms of the football, you can actually just he thinks he thinks it's funny, but anyway, this is the best way to hold your baby when you're trying the football style. And you can do it. Look at him trying to feed. You can do it with on the left side or on the right side. Okay, wriggly man. Hi. Okay, when you're feeding any other way, make sure that their hand is down here, their belly is to your belly, and then they will find. Are you feeding, my love? You can't feed through clothes. And they will, sorry, he's a little wriggly because he wants to go down the floor and play. But yeah, and his feet are always touching some part of my body. Especially when he was younger, his feet would touch my tummy. Anyway, let me get him back up. Hi, my love. But find the position that works for you and your baby. Some people even put their baby on their belly, belly to belly, like literally flat. Belly to belly, and they feed, and that has worked for me too. So I've tried all styles. Sorry guys, this showing you the position is, look at him, he's so wriggly, he's so wriggly, he's so wriggly. This trying to show you the position is actually making him want to feed, so I'm gonna give him back to my husband. So yeah, just find the position that works well for you and your baby, okay? Then other thing is, make sure that you nurse soon after giving birth. The sooner the better if you're able to. And also embrace cluster feeds, right? There are times when your baby will want to feed more during growth spurts. This will happen if, you know, it's during certain weeks, during certain months. Just embrace those and go with the flow. The other thing is just hydrate. I realized after giving birth, I cannot stop drinking water. When you're in the hospital or if you're at home, make sure somebody's always bringing you liquids or water or little juices. Or make sure that you hydrate as much as possible. Gatorade is also a big help. Guys, a lot of the times people say that you should avoid pacifiers or bottles at the beginning. They say that maybe you should breastfeed your baby exclusively for the first couple of weeks, but that's not an option for some of you who need to bottle feed your baby, or if you're using formula. We never had to worry about nipple confusion, so just play it by ear and see. And also invest in some breast pads, because you will be leaking a lot, especially if you get really full. So you want to make sure that you get some breast pads, especially if you're going out. So if you're also able to, why don't you watch somebody else breastfeed? If you're not totally reserved, watching somebody else can be really helpful. I know I've fed in front of my sisters, and I'm hoping that they're encouraged. If you're out there, sisters, I hope you're encouraged by watching me feed my babies. So if you're not sure, just watch somebody else feed, ask questions to people out there, and most importantly, as I mentioned to you, ask advice and information from your lactation consultant or your doctor or a nurse. Even try and call some places and just ask, guys. Do not be embarrassed. Make sure you're relaxed. I know you're stressed in the beginning, especially if you're a first-time mom and you're not sure what to do, how much your baby is taking. Trust me, learn your baby's cues. You'll know when your baby is hungry, and they will stop, when they're sleepy, when they're full, and if they seem to feed often, just let them feed. You will know that your baby is taking enough milk when they're making about 4 to 5 wet diapers every single day. I'm not saying necessarily dirty diapers. I'm going to go ahead and move on to how you feel, right? And this will also help you, because you might want to breastfeeding is a beautiful thing, or it can be what most may call hell on earth, but don't worry. If you have the right latch and you just stay patient, guys, patient pays, because after a couple of weeks, no matter how much pain you'll feel, because sometimes when your baby latches on, you'll feel as though you've left this earth and you've come right back times 1,000. But guess what? That all goes away in a couple of weeks. Your breast will get used to it, and feeding will actually be really enjoyable. So stick with it, guys. You can use a warm towel, and that will help with your milk letdown. You can air dry your chest, or you can actually use your own breast milk to soothe your nipples, or lanolin. Lanolin, some of those things didn't really work for me. I just waited and I powered through it, and eventually breastfeeding was such a beautiful thing. Your body's getting used to something new, something beautiful, something natural. So don't worry, you'll get used to it in no time. Just stick with it, guys. So there are many different ways, to help bring some relief, but like I said, it's all about patience, guys. Your body's going through so much. Just make sure that you give yourself time. In terms of bottle feeding, right, there are many bottles that work for us. If you're formula feeding, sometimes your formulas will come in bottles that have their own nipple, and this is a nipple that actually came with formula we had from long time ago, and it can actually fit over some of the bottles that we own. And this is just an old bottle, guys. This is old school. They gave me this when I was sick. After I gave birth to her, I developed sepsis, and it was a very dangerous situation for me, but I'll tell you all about that, how I almost died after having my baby girl. But just, these are bottles that they give you at the hospital. They'll make sure to give you as many bottles as you need. In terms of bottle feeding, I have a couple of tips. One, find the right bottle. A bunch of bottles worked for us. We were really lucky with both babies, and let me show you a couple of the ones that we have. We have the Avent bottles like this one. We actually got some as a gift from Motherhood Maternity. Thank you so much. This worked perfectly. Honey, you like this, right? These ones, yeah, they're perfect. They worked for both babies.
Perfect for newborns.
Yeah.
Between up to like 6-7 months.
Yep.
That's perfect. Yeah.
Perfect for, like he said, perfect for newborns to 6, 7, 8 months. This is Avent, and then we have. Sarah, can you pass me that one? Thank you. The bigger one, the Philips Avent bottle, lets you have a little more milk. So this worked for well. This really worked well for us. Another thing was we used this with Sarah, but not with Franco. If you have babies who are colicky, you want to make sure that you're using bottles that reduce that. So this was really good. The Playtex Vent Air was really good with Sarah, and it detaches. It has a couple of parts, but it was super good. As you can see, my daughter is trying to present with me, so I hope you can actually hear what I'm saying. And these other bottles that I have here are actually Medela bottles, and they come with they come in a pack. They're different sizes. I loved this one because I could pump into this bottle with my Medela pump and just seal it, and then just put it straight to the nipple with the cover, and freeze it or put it in the refrigerator. And whenever, if I'm not at home and my husband, or if my husband was feeding, maybe if I'm sleeping or something, then this is perfect. It's ready to go. Either put it in a bottle warmer, or you can put it in some warm water to let it warm up. But this was just perfect. It's my favorite bottle, actually. Very simple, as you can see, not complicated. We did freeze some milk in bags, and I'll talk about that in the pumping section. But okay, so back to the tips. So 1, make sure you find the right bottle. 2, make sure you find the right teat or nipple, because they're nipples that have one hole, or they release, this is a slow release, and then there are others that release a little bit faster, and you want to use the faster ones as your baby grows and as your baby progresses. And once again, do not worry about how much milk your baby is taking. They know what to do, unless they're not gaining weight properly, which you'll find out, through your doctor, or you will be able to see it yourself. Those are the bottles that we used, and the bottles that were helpful to us as we bottle fed our babies. In terms of bottle feeding as well, you want to make sure, especially if you're trying to switch from breastfeeding to bottle feeding, make sure that you also don't feed your baby when your baby is overly tired or when your baby is too hungry. That is not a good combination, and you want to make sure that you're also relaxed and the baby is relaxed, and that will equal successful bottle feeding. This is the other Medela bottle that I wanted to show you guys, and it's pretty nice. So we've had success with a bunch of bottles. Next, let me go ahead and move on to pumping. So in terms of pumping, make sure that you've cleaned your chest, you've washed your hands, and that you have a space to pump, right? A quiet space. If your baby is close by, that's also a good stimulant for your milk. Or if you need to look at a picture of them or look at them through the monitor, that's a really powerful. Do not underestimate how powerful that is. Just the visual, just looking at your baby, it's really important, and it will really help with you as you pump. Make sure that you take lots and lots of water, and you keep on hydrating yourself as you pump. After you've breastfed your baby, just pump for about 4 to 5 minutes. Guys, little helps. Within no time, you're going to have a really good milk supply in your freezer for when you're away, or when your significant other or partner needs to feed the baby. And this is what we use. We use the Lancino bags, and they're really good, guys. And what I do is I pump into the bottles, whether it's one of either or of the 2 machines that I showed you, and the bottles that fit them, and then I pour the milk into this Lancino bag, right? And then it can take up to 5 or 6 ounces, and this is actually really great. You wanna hold it, baby? It's really great because it has a double zipper on it, and you can write the amount of milk that you've you've pumped, and the date and your name and the time that you pumped. That's really good for when you're storing them in the freezer, so that you can know which ones to use first. Your partner is such an important support system if you're somebody who has a significant other, because they can really help you. They can bring you water, they can help you with just little ways to relieve your stress. So partners, if you're out there, please help your significant other, even if she needs to take a little bit of a nap, if she needs some little time to pump, please help her with that as well. I was going to say 5 minutes, but that's not really true. Give her 15 minutes, let her go to the bathroom and get ready to pump, and then in the actual time for pumping, relieve her stress, whether it's a little massage, whether it's hugging your partner, whether it's just bringing them their meal, or taking your other toddlers away for a little while. It doesn't matter, guys. Whatever little that you do, it's a great support for your partner. So thank you guys so much for watching. If there's anything else that I've forgotten, I'm going to make sure that I share that with you in my blog. I'll share a link to my blog down below. I'll cover this topic in my blog as well. But otherwise, thank you so much for joining us. We look forward to seeing you next time. If you have any questions, please leave them in the description box. In the comment section below, and I'll leave some information in the description box. Thank you guys so much for all the love that you show us, and we look forward to seeing you in our next vlog. See you guys. Bye. Hey guys, these are my 3 bonus tips for you. make sure that you burp your baby, get that wind out, because if you don't, the burp is going to be stuck within them. It's going to be hard for them to fall asleep, and it's going to be difficult for them to continue feeding. And I've noticed that with my son. So if I'm lying down with him, I'll sort of lift him up to a sitting position, I mean he's asleep, and support him and wait for that burp to come out, or I'll put him over my my shoulder over here and rock him. It will come out, or you can pat your baby on the back or rub them, but make sure that burp comes out because they will eat more. My second tip for you is make sure that when you're getting the right teat for your bottle, that you get the one that mimics the breast, right? And you can try the latex ones. Those are really good. And then my third tip for you is make sure that you lay out your stuff, right? In terms of pumping and you know, expressing milk. Make sure you lay out your stuff. It doesn't matter whether you have a particular section, one of those you know, drying racks, baby drying racks, or whether you have a paper towel, whether you just have a cloth. Just make sure you line up your bottles, their caps, your breast pump parts, and remember, in between like throughout the day, when you're pumping, you don't need to thoroughly wash your parts. You can just rinse them, put them in the fridge or in a Ziploc, but then when you wash them, make sure you thoroughly wash them and line them up on your paper towel or your cloth or your drying rack. So I hope those 3 bonus tips will really help you guys as you breastfeed your baby, as you pump, and as you bottle feed. We love you guys. See you next time. Bye.